warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Tabik pun.
Ya pun.
Good morning, ladies and gentlemen. Welcome to the International Guest Lectures on Environmental Health, Medical Geology, Heavy Metal Pollution, especially mercury in humans. This international lectures is organized by Master of Public Health Program, Faculty of Medicine, Universitas Lampung, as part of the 19th anniversary of Faculty of Medicine, Universitas Lampung. My name is Kartika Agustini, and I am honored to be your Master of Ceremony for today. First of all, I would like to welcome Honorable the Dean of Faculty of Medicine, Universitas Lampung, Honorable the Vice Deans of Faculty Medicine, Universitas Lampung, Honorable the invited speakers, Professor Masayuki Sakakibara and Thiri Kyaw, Ph.D., and also the lecturers and students from Universitas Lampung and other institutions. Before we start this program, please allow me to inform all of the participants to setting your audio in mute mode during this event. You can turn on the audio only if you have been allowed by MC or moderator. Participants can write the comments or question by writing in the chat box. To all participants, we also provide free certificates, so please fill in the link of attendance list that we provide in the chat box. For today's program, we will have 4 parts. First, the opening speech by Dean of Faculty of Medicine, Universitas Lampung, Professor Dr. Dyah Wulan Sumekar RW, SKM M.Kes. Second, the main part of these international lectures, we will hear about environmental pollution, health problems, and their solution by Professor Masayuki Sakakibara from Japan, project leader, Research Institute for Humanity and Nature, professor at Department of Environmental Design, Faculty of Collaborative Regional Innovation, Ehime University. And this session will be followed by lecture on the diagnosis of chronic mercury intoxication by Thiri Kyaw, Ph.D. from Myanmar, Medical Researcher SRIRE Project, NIHN. For the last agenda, there will be a discussion led by Dr. Endro Prasetyo Wahono, ST M.Sc, as our moderator. Now, to start this event, I would like to invite Professor Dr. Dyah Wulan Sumekar RW, SKM M.Kes, to give the opening speech. Professor, the time is yours.
Okay. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Abi pun.
Ya bun.
Professor Sakakibara and Dr. Thiri Kyaw. Tabi pun is greetings in Lampung language, which means asking permission to speak, and answer with ya pun, which means to be allowed. First of all, I would like to welcome the Honorable, our invited speakers, Professor Masayuki Sakakibara Sensei, as project leader, Research Institute of Humanity and Nature, and also as professor at Department of Environmental Design, Faculty of Collaborative Regional Innovation, Ehime University, Japan. Good morning, Prof. Masayuki Sakakibara, and welcome to Faculty of Medicine, University Lampung. And also, I would like to welcome our invited speaker, Dr. Thiri Kyaw, Ph.D., as medical researcher, SRIRAP project, Research Institute of Humanity and Nature. Good morning, Dr. Thiri Kyaw. Welcome to Faculty of Medicine, Universitas Lampung. I would also like to welcome the Vice Deans of Faculty of Medicine, Universitas Lampung, all faculty members, staff, and students of Universitas Lampung, and all valuable participants. Ladies and gentlemen, as we know, many researchers have discussed and documented that some heavy metals have many effects on environment. They have wide effects on human health as well. Heavy metals considered as complex environmental pollutants, and currently their level increased significantly not only in the air but also in water and soil as a result of industrial and agricultural activities. Some of us might know that it causes many disorders, including cancer, cardiac disorders, bronchitis, asthma, pneumonia, emphysema, and many other diseases. It was also reported that most human health problems was associated with heavy metal toxicity, like cancer, anemia, damage in kidney and liver, respiratory system, and also breast milk. In response to that issue, Master of Public Health Program, Faculty of Medicine, Universitas Lampung, proudly presents the International Guest Lectures on Environmental Health, and today our speakers will give a lecture with special topic on the effect of mercury in humans. Ladies and gentlemen, for your information, this International Guest Lectures actually is one of an events in celebrating the 90th anniversary of Faculty of Medicine, Universitas Lampung. And as an academic institution, the age of 19 is, of course, considered to be young. However, we have had 5 study programs, namely Medical Education Study Program and Medical Doctor Profession Study Program that has been accredited A, Pharmacy Study Program, Master of Public Health Study Program, and Medical Specialist in Pulmonology and Respiratory Medicine. We are also preparing to open specialist program in surgery, internal medicine, and obstetric and gynecology, as well as the public health doctoral program. Ladies and gentlemen, in this occasion, I would like to express my gratitude to Professor Masayuki Sakakibara and Dr. Thiri Kyaw for sharing your knowledge and experience to us. Thank you also to Dr. Endro for facilitating this session, and appreciation to all participants for your enthusiasm, and all the organizing committee for your hard work to make this event happen. Last but not the least, I do apologize if there are some inconvenience during this event. We do hope this guest lecture series could give us a new insight and could help to expand knowledge among lecturers, experts, and students. And finally, ladies and gentlemen, by saying Bismillahirrahmanirrahim, this International Guest Lecture on Environmental Health is officially started. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi
wabarakatuh.
What an enlightening speech. Thank you very much, Professor. Now, we will step on to the main part of these international lectures. This part will be moderated by Dr. Endro Prasetyo Wahono, ST, M.Sc. But before that, please allow me to read the curriculum vitae of Dr. Endro Prasetyo Wahono, ST, M.Sc. Dr. Endro Prasetyo Wahono, ST, M.Sc. is one of lecturer in Civil Engineering Department and Headmaster of Public Health Program, Universitas Lampung. His current position now as Associate Professor and Head of Civil Engineering Master Program, Universitas Lampung. He also researcher at Environmental Research Institute, Universitas Lampung, and individual consultant of WWF Indonesia. He received his undergraduate at Water Resources Engineering, Brawijaya University, Indonesia, Master Course at Water Resources Development, University of Manitoba, Canada, and also Hydraulic Engineering at UNESCO IHE Delft, the Netherlands, and he received postgraduate course at Climate Change, United Nations University from Japan. His doctoral degree from Civil Engineering Gajah Mada University, Indonesia, and visiting scholar at University of Kentucky, USA. His research interested in environmental management, eco-hydrology, river dynamic and engineering, and eco-hydraulic. He also have a lot of major publications, as we can see in the slideshow. Without further ado, let's welcome our moderator, Dr. Endro Prasetyo Wahono, ST, M.Sc. Dr. Endro, the stage is yours.
Thank you, Kartika, already introducing me to the audience. Ladies and gentlemen, welcome to this occasion, international lecture organized by the Public Health Master Program, University of Lampung. As already introduced, I'm Endro Wahono, and I'm going to be chairing this international lecture. Our main topic today will be heavy metal pollution, especially we will talk about the impact of mercury and on human health. And we have very honored to have two remarkable speakers, both of them from Research Institute of Humanity and Nature from Japan. The first speaker will be Professor Masayuki Sakakibara. Morning, Sensei. And he is a project leader of the Institute. And we are very honored to have Professor Sakakibara with us today. Sensei will give us the lecture on environmental pollution, health problem, and their solution. The second speaker will be Dr. I will show the CV of the Sensei. Yeah, as we know that already mentioned by the MC that Professor Sakakibara is a project leader of the Institute and also the full professor at the Faculty of Collaborative Regional Innovative Graduate School of Science and Engineering at Ehime University. And the Sensei have already published enormous of the publication related to the environment, particularly on the heavy metal and also mercury pollution. As we already known that he also have a project in Indonesia, in Sulawesi. So we can see the publication numbers publication. So without any further ado, I think I will give the screen to Professor Sakakibara Sensei to give a lecture for the first session today. Sensei, screen is yours.
Okay. So can you hear my slide?
Yes,
Okay.
very well, very well.
Okay, thank you very much.
Welcome.
Good morning, everyone. So first, I want to say especially thanks to people. So I'm truly honored to be invited this time to the International Just a Guest Speaking Seminar. So first, I want to introduce my research institute. This their name is the Research Institute for Humanity Natures. This is National Institute in Japan. So commonly we study on the global environmental problem. Especially we focus on the humanity and natures. This means we just amalgamate the literature and the natural science, and then we try to find the solution to solve the environmental issues. Today, I want to talk about environmental pollution problem, but I want to focus on the solutions. This is very important for the society. So, but still, humankind, just cannot arrive at, cannot just achieve the solution. Because then this is the society problems. We cannot solve the only technology. We need it, so we have to understand the anthropogenic, just matters, and then also sociology, and then also, of course, culture problems. And then we will combine the natural science and just humanities. Okay, first I want to, I try to just explain using simple word. First of all, this is a very common word, environmental pollution. But this is the first I want to start from this word. So environment is maybe everyone know it. So just everything that surrounds us, including not just living, but also non-living materials. So and then environment pollution is contamination. Contamination of airs, water, and the land from man-made waste. But the next sentence is very important. Commonly, many people just don't realize that this sentence. All environmental pollutions ultimately before to individuals. Not only just the persons make pollution, all humankind and also natures have this effect. This is a very important portion, especially global just environmental pollution make the effect to all of living. Okay, and then today we will just focus on the heavy metals. This is what is not a scientific word. So heavy metal means commonly in the chemistry, scientists never use the heavy metals. This is the social word. Okay, and then definition also not so clear. But in Japan, also example, Ministry of Environment also use this word because of this can easily understand. People can just understand easily. And then this one is generally we use heavy metal for the element with a space gravity that at least 5 times the space gravity of waters. This is the waters. Okay, density is greater than the 5 grams per cubic centimeters. Example, arsenic, this is 5.7. Iron, commonly iron is our essential element, and then, but if included too much, the environment includes too much iron, also may become pollution. And the cadmium, lead, the mercury, these elements is heavy metal, so-called heavy metals. And then, so in the periodic table of the element, this is the estimate, but heavy metal is more than iron, but generally, so we say, but of course, chromium or manganese, also vanadium, also sometimes we say it's they are heavy metals, and then definition about 5, more than 5, and then also sometimes include these elements. And then also commonly, so just we have bad images on the heavy metals, but we commonly humankind use a lot of heavy metal for the benefit. Okay, example, so some heavy metals are nutritionally so essential for healthy life. Example, iron. We need iron, the copper, and the manganese and zinc. Example, so iron is so just this is the essential element for the enzyme. Also, maybe zinc. Also, if we so just we don't use enough zinc, we have a taste problem on the tongue. So these elements are commonly found naturally in foodstuffs, in fruits and vegetables. By a multivitamin product also include these elements. Okay, and then we use many benefit from heavy metals. Also, maybe in the medicine, commonly we use lead as a radiation shield around the X-ray equipment. It's also very so important. So just functions on the heavy metals, and then we use the many heavy metal for the diagnostic medical applications. And they also maybe it's also very common in the industrial applications, such as the manufacturers of pesticide, battery, alloy, electroplated metal parts, and textile dye, and the steel. So in the many, so just the industry, we use these elements. But simultaneously, heavy metal have a toxicity. And the heavy metal become toxic when they are not metabolized by the body and accumulate in the soft tissues. This is a very important portion. So just this means the example iron also so become toxic if we take too much. And then also all elements have a heavy metal have this characteristic. It's maybe too much to it. We don't commonly don't take the excess volumes. And the heavy metal may enter the human body through the food, water, air, and absorption from the skin, through the so just sorry. Heavy metals so just may enter the human body through the food, water, air, and absorption from the skin. When they come in contact with human in agriculture, in manufacturing, pharmaceutical, industrial, residual settings. There are many ways we will take the heavy metals. So, and then so in our lives, so just we so just classified into 2 types element for the human and animals. First one is the essential element. This is necessary for human animal life. Okay, and another one is a non-essential element. It means that we don't need this element. Example, so just if we take this element, so just there are no benefit, and then also maybe toxic, become toxic. This is the non-essential element. And then essential elements, we can so just divide it into the major element and the trace element.
Okay.
Major element is the calcium, so chlorine, so magnesium, phosphate, potassium, sodium, sulfur. And the trace element is the chromium, cobalt, copper, fluorine, iodine, so the iron, manganese, molybdenum, selenium, so just zinc. But of course, so just the examples, if we too much take the zinc also become toxic. I already explained. And then the other side, so just no essential elements. Commonly, if we take these elements, so just maybe over the beyond the so just limitations, so concentration, so we have a health effect. Okay, and then today, so mainly talk about arsenic and then so just mercury. This is a very famous non-essential element for us. So this is a arsenic. So just this is very famous in Bangladesh. In Bangladesh, there are a lot of underground waters cell commonly polluted by arsenic. This is natural, so just resource. And then the health impact from arsenic exposures. This is a very so just severe example: cancer of blood, kidney, skin, livers, and then hyperpigmentation. Hyperpigmentation is the lead one. So like maybe this brown spot, like raindrops, even so on the hand. And then so just hyperkeratosis, the backside of foot. And also finally, bone disease, and then also skin cancer also. This is a subject effect by the arsenic. And then so there are many localities, so just on the arsenic contamination site in the world. Commonly, so just affected for aquifers. This is Bangladesh, the very famous one. But in Japan also, we have some place on the arsenic affected aquifers. Mainly, so just a marine deposit. So marine deposit, so just increase a lot of so just clay minerals. These clay minerals are attached on the surface, attach the so just arsenic on the surface. And sometimes release after so change the environmental conditions. Sometimes so just arsenic elements so release into the environment, and then so make the pollutions. Also arsenic related to mining and mineralizations. This one is a red spot. Red circle one is so just mining, so just areas. And then this one is in Indonesia only one spot, but I think there are many. I know that one because so commonly gold deposit so accompanied the arsenic. This is on the geology, we know these ones. So geothermal, so just activity, so just bring the gold with so arsenic, and then gold deposit areas gold deposit mining site, commonly the altered rocks include this contain the arsenic. And then so during mining, so this arsenic so released to the leach out from the rocks and then so enter the environment. And then geothermal water sometimes includes arsenic. In Japan also, maybe this is a very famous place, but in Hokkaido, Northern Island also have. In in Indonesia also have. In Gorontalo, so along the border rivers, there are many hot springs. These hot springs so just contain hot spring water contain too much arsenic. Example, around 10,000 ppbs. This is maybe the highest concentration in the world, I know. And then also there are many places, and then especially mainly in the circum-Pacific areas. This is based on the geology. So I already told you, so just the volcanic activity brings the hydrothermal waters, and then this water includes a lot of arsenic. And also altered rocks, host rocks includes arsenic, and sometimes beach out. In the continental crust area, like Eurasia and then African, these places so commonly not so much arsenic. They're mainly in the island rock area. Okay, and then so next one is the mercury. This is also very, very important element for Indonesia. Commonly natural environmental source also, maybe with a volcanic, so just eruption, and also anthropogenic environmental source. Most popular one is the coal-fired power plants. When so just we burn the coal, and the make the smoke, and they make the smoke. This smoke includes mercury. But also maybe most significant, so just the mercury pollution by the amalgamation in mining site. This is called the mining site. In Indonesia, on this mining, maybe more than 300,000 people join, and then so make the mercury pollution. This is also maybe later, Dr. Thiri will talk about this so problems. And the mercury so exposures so make the many effects. Mainly central nervous system. This is tremor, mental change. The tremor is I already so just met some person have a strong tremors in the gold mining area in Gorontalo. It's also very serious problems, and also kidney effect, and then sensory, visual, auditory function. There are many effects, especially central nervous system. So on the mercury pollution effect, maybe you know that this name, so Minamata disease. The Minamata disease is caused by the methyl mercury poisoning. This is by the factory, the wastewaters by the Chisso factory. And then during 1932 to 1968, local, so just mainly fishermen, especially, they suffered the consequence. And Minamata city is here. Okay, and then this is the Shiranui Sea, inside the sea. You can understand this is only some place enter the water and enter and go out. The ocean water, so just enter, go out. Only here, only small, narrow canals, and then this water, if this water so just polluted by mercury, this water cannot exchange easily, and then so remain here. And then many fishermen so along the this Shirano Sea, many fishermen so eat the polluted fish, and then so they have problems. This is the process I show the process. This one is so just factory. The tissue company so just make the acetylene, okay, using mercury catalysis. After this, mercury so just transform to the methyl mercury, and then in this ages, so just people so didn't treat this material, and then so enter the ocean directly, and then so along during the food chains, the big fish includes contained a lot of so just mercury, and then fishermen so ate this fish too much, and then they have health problems. Around 3,000 so just people so just identified by Minamoto disease, but Minamoto disease is a very severe so just disease, and then between normal to the Minamoto disease, there are many spectrum. So, and then so just the government also couldn't identify the effect, the causes, and then maybe totally some scientists estimate the number of so just a person get the effect. Around 200,000 people got it. And then this is a very famous symptoms, includes ataxia, so just numbness in the hand and the feet, general muscle weakness, narrowing of the field of vision, and the damage to hearing and speech. The shades are very famous person, so just photo by the Eugene Smith. He's a very famous, so just United States cameraman. So in the extreme cases, insanity, so just paralysis, command, and death, follow within a week of one set of symptoms. Maybe this one, within few weeks, some people die. So, but the problem is, of course, this is the environmental pollution, but this is also make the society problems. So many people so just want to hide so their effect. If they have a family catching the so just Minamoto disease, commonly that family so just should be so isolated from the societies, because people are afraid on this disease, because they didn't have enough information, and then they are afraid, and then so just they hated them, and then so just environment problem become a very complex problems. We call this one wicked problems. And then so just environment pollution is not only so just medical problems. This is society, kind of society problems. Recently, so just one so famous so actor, so just this is he's a Johnny Depp, so very famous actor, and then so he so just played Eugene Smith, the famous cameraman, him. And then so just now release last month. If you have a chance, please watch these movies. Okay, and then I told you so just environment pollution problem is a kind of wicked problems. Wicked problem is usually social and culture that is challenging or impossible to solve either because not enough is understood about the problems and the number of stakeholders involved, and the number of varying opinions, the economic burden, or the impact of these problems with other problems. This is also just more than 50 years ago, already scientists identified these problems. But still, we don't know where on these problems. This means that we cannot solve these problems easily. Today I want to explain the environmental pollutions, also one of wicked problems in the world. This is how to solve these problems. This is very important for us. And then first I want to explain, what is the wicked problems? Example, now we face on the global warming effect, and also poverty problems, environmental pollution, terrorism. This is also maybe kind of wicked problems. Maybe you can identify the many wicked problems. Cannot solve it easily. Mean that it's wicked problems. How to solve the wicked problem? This is today's most important core portions. This is the first, we need interdisciplinary research. And I want to encourage the interdisciplinary research, creating an environment for innovation in thinking about the wicked problems. And then this means enabling the disparate experts to work together. And they also need a collaboration. This is not a common collaboration. Researcher and then non-researchers, stakeholders. We have to collaborate with stakeholders for solving wicked problem, because this is a society problems. And then in my institute, we focus on the transdisciplinary research. This research is a wonderful solution to solve the problem, wicked problems. And then various discipline researcher and then stakeholder collaborate for the solving the wicked problems. Okay, and then especially on the environmental pollutions, I want to explain the relationship on the discipline and then ecosystem, researchers, society, and then ecosystem, and then society, common society. So commonly, heavy metal, especially on the heavy metals. Heavy metal is of course geologic materials, and then first these elements come from rock or minerals. And then naturally, sometimes naturally emit anthropogenically also. And then this just a geogenic contaminants. So if enter the ecosystem, of course, first enter the non-living, ecosystem environment is air, water, sediment, and then soils. But later interact with living ecosystem, and the animal, plant, human beings also have an effect. And then also food chain and the air pollution. So many processes interact with the society. And then also negative impact on human health. And also finally, impact on the society. First, we should understand that this process. And then how to solve the problems, I already told you. So many discipline scientists collaborate with non-researchers for solving these wicked problems. So examples on the medical science, which so just a discipline researcher can collaborate. First, this is the medical science, so areas, and then social science, bioscience, ecological science, and the geoscience. This is we focus on the geoscience and then medical science, but we need many discipline scientists for solving these problems. I say this is the big mess science. It uses the first capital use, and then emerging interdisciplinary scientific field study the linkage among geoscience factors and then their impact on the human health and ecology. Maybe I think more another discipline scientist also can join. And then I already told you how to solve these problems. So just many discipline scientists, of course, with other discipline scientists, and then collaborate with stakeholders in the society, and then for find a solution to solve these problems. And this is we commonly conduct the transmitted practical research and then social implementation research. Simply just like this one, so maybe you can understand so easily. First, just researchers, if we found the environment pollution with health problems, maybe talk with just the local government, energy or private sectors, and then also inhabitants. And then also maybe for the starting discussion, we need a mutual trust and through dialogue, so mutual learning. And then create the groups of study and then practice together in the society. We need this one because they have an effect on this problems. And then we call this a group, Transdisciplinary Community of Practice, TDCOP, we call this one. And then also various stakeholders and researchers. And then this is the informal groups. And then after this, we will start the more formal multi-stakeholder collaboration, and also find a solution on these problems. This is the process of solutions, process to the solution. So also just to wicked environmental problems. Okay, thank you very much. This is the final slide for me, but I already told you today I talk about what is the environmental pollution, and everyone have an effect. This is not only local people, also just environmental pollution, so finally fall down to individuals. And also this pollution make the health problems. We already know this one. And then for solving these problems, it's not an easy one. And then also maybe we should collaborate with many discipline researchers and then non-researchers stakeholders. First, just informal, scientifically make clear, and then for the preparation of the next step. And then after deeply understand, we can move to the multi-stakeholder collaborations, offshore collaboration. This is with government, also maybe private company and the NGO. This is offshore work. And then for showing the initiative to solve these problems. Okay, this is today my presentation. Thank you very much for your attention.
Thank you very much, Arigatou gozaimashita, from a lecture from Sakakibara Sensei. Ladies and gentlemen, I think this is the very nice presentation and also very important because as we know that Lampung have potential of resources related to the geothermal energy and also coal mining. So these two resources have already mentioned by Sensei that this is a potential related to the two main non-essential element of the heavy metal, which is arsenic and also mercury. So what I want to highlight from the lecture, I think is the problem is very complex. Then the integrated collaborative approach have to be conducted to solve the problem. So again, I would like to inform to the all participants, if you have any question to any speaker, please leave a message in chat room or even in the YouTube. So you can ask anytime during the lecture. Any question is welcome. So, okay. Now we come to the second speaker. It will be Dr. Twin.
Sorry, you can call me Thiri.
Oh, okay.
Yeah.
Thiri. Okay, sure.
Thanks.
Yeah, Dr. Thiri is as a researcher in the institute. Also, she also already have a lot of research working on this kind of heavy metal. As we can know, the on the screen that Dr. Thiri is. Wait a minute, I will. The screen is too small, so I can read. Okay, now. So Dr. Thiri is graduated from medical research, neurology, and clinical pharmacology at Graduate School of Medicine, Ehime University. And now she is working for the institute as a researcher, and also have a lot of application related to the heavy metal pollution. This is the, I mentioned one of the publication is published in International Journal of Environmental Research and Public Health, which is Health Impact Assessment of Artisanal and Small-Scale Gold Mining Area in Myanmar. So I think we also have a similar problem in Indonesia. So without further ado, please welcome Dr. Thiri. Screen is yours.
Thank you very much for inviting me to this special event. And first also, I'd like to say happy anniversary to Medical Universities Lampung. And also thank you very much for to the Master of Public Health Program, Faculty of Medicine. Let me share my screen. So can you see the screen?
Yeah, well.
Yeah,
very
thanks.
well, yes.
Yes, so I am Thiri Kyaw, and first also I was a medical doctor in Myanmar, and then I attained the medical research degree in Ehime University Medical Graduate School of Medicine. Then I started working at the postdoctoral researchers in Ehime University, Japan. Then now currently I'm working as a medical researcher at the Research Institute for Humanity and Nature, Kyoto, Japan, at Studi project. So today I'd like to talk about the diagnosis of chronic mercury intoxication. So in my lecture, I will start briefly talking about the mercury, the types of mercury, how we are exposed to mercury in our daily life. And then I will go details for diagnosis of chronic mercury intoxication. So as Professor presented in his slide, mercury is very dense and it is 13.5 times denser than water. As you can see in the picture, so even the iron cannot be immersed in the mercury. So next is there are important three types of mercury, such as elemental mercury and inorganic mercury compounds and organic mercury. So elemental mercury is symbolized as Hg0, so which is used in ASTM, and I will also explain it later in later slides. And second, inorganic mercury compounds are used in the as like preservatives and in the vaccinations and some cosmetic products. And the last, organic mercury is which is being formed from the conversion from elemental mercury. So organic mercury has methyl mercury, ethyl mercury, and methoxymethyl mercury. So methyl mercury is very famous in history, such known by the incident of the Myanmar disease. Ethyl mercury is which we can see in the vaccines called as a thimerosal vaccines as a preservatives. And so next is now I like to say, how are we exposed to mercury in our daily life? We don't notice that, but we we can be exposed to mercury. And first is of course the big issue is from gold amalgam used in the ASTM minings. So is this an elemental mercury type? So mercury is used to get the gold from the old rock. So this method has been used since the ancient time until now because mercury is very cheap and it can be easily accessible, and also compared to the other methods, so it's a user friendly. So a lot of ASTM miners in the ASTM mining sites use mercury, and the figure shows that. This is the mercury, the gold and mercury combination called the amalgam. And then the right figure is the Kachinov mining process, which mercury is used. So this figure shows the ASTM sites around the world. My country, Myanmar, is also have a lot of ASTM sites. And Indonesia has many sites, and Indonesia use mercury, a lot of mercury. As you can see in the pictures, Sakakura is big. And then another one is we also using elemental mercury in healthcare devices, previously in the thermometers, and also pressure cuff called the mercury sphygmomanometer. So I don't know about Indonesia, but in my country, some places they are still using this type of pressure cuff in the hospitals. And the next is another source of elemental mercury is dental amalgam. As you can see in the picture, is liquid elemental mercury is applied in the dental, so people can be exposed by inhaling the mercury vapor discharge from the dental amalgam. So this method should be prohibited in the dental practice. So the next, I will talk about inorganic mercury compounds. So these are normally used as antibacterial treatments in ancient time, such as syphilis, worms, yaws, and so because it has antibacterial and bactericidal activity. So, and it also used in the cinnabar, the protectors of the red pigment for the paintings and dyes and wells. So I think some still using these. cinnabar, so people can be exposed from that inorganic mercury compounds. Another type is, I think, is quite popular in modern times. This is the illegal skin cosmetics. It has a whitening effect, and they have sample promising, they saying that you can get white in a very short time, and then surely it has mercury. So mercury inhibits the melanin protection, and so that's why it gives an instant white effect. So, but these are very dangerous compounds and products which we can be exposed in our daily lives, but without noticing that. So, and the last one is the organic mercury. So this, as you know, I think you already know that organic mercury can be found from the transformation from the elemental mercury, which has been exposed or discharged from the AST minus sites and other industries which use elemental mercury. So the mercury is the gray spots is the elemental mercury, and the red one is the methyl mercury. So mercury, elemental mercury is discharged in the water, and then it is transformed, methylated by the material transformation from elemental mercury into more toxic and bioavailable form of methyl mercury. Then it doesn't stop there; it enters to the food chain, and so the fish accidentally inhale the mercury, and so as you can see in the food chain, small fish are eaten by the bigger fish, and finally the human consume the fish. So mercury cannot be discharged from fish, and it is bioaccumulated by time and time. And then later, when human consume, so a lot of big amount of mercury, methyl mercury contents enters to the human body. So the one point we have to remember is that mercury cannot be removed by cooking of the fish. Even you cook either raw or cooking style cannot affect the content of mercury. So there are species of fish which have a high content of mercury, such as marlin, tuna, shark. Okay, tuna is very delicious and very popular. So, but we have to consider the effect of mercury. And saltfish and king mackerel and time fish, they have a higher mercury concentrations compared to the other fish. So it is a global contaminant and also very toxic to human life. So this is just a summary of mercury containing products in our daily life. So it is not like a short time and not very high amount at the one time, but chronically overloaded by slower without noticing that. And secondly, I would like to explain what happens after mercury enters our human body. So let's say mercury enters human body, and suddenly it would cause epigenetic mechanism. And epigenetic mechanisms is called the DNA methylations. So which causes cellular destruction, a lot of changes related to the cancer and recoding of the messenger RNA, which also have a genetically dysfunction and histone modifications. So the final effects are to the nervous system, endocrine system, immune system, and the cardiovascular system. So nervous system is brain and of course central nervous system and peripheral nervous system both. But central nervous system is more hand, and the cardiovascular means, so as you already know, lungs and heart disease. The endocrine system is related to the hormone. The immune system is mostly with the cancers, can cause the cancers. So these are the genetic changes by mercury. And then, so the absorption of mercury is different or depend on the types of mercury. The first one, elemental mercury, is very high lipophilicity. It means that it can be absorbed to the lipid tissue, like fat tissue. So we have in our body that a lot of blood-brain barrier has a lot of fat. Placenta has fat. So elemental mercury can easily cross blood-brain barrier. So it can enter through the brain central nervous system and also placenta. So it can cross the placenta very easily and attack the fetus while during pregnancy. And the next one is inorganic mercury. Sorry, I left to mention one point. Elemental mercury is mostly affected to the lens. So it is absorbed very quickly from the lens. So it has 80% of elemental mercury is absorbed once inhaled, and that it is poorly absorbed by gastrointestinal. So you cannot see in the feces too much, or maybe urine more. So the half-lives of elemental mercury is 20 to 66 days. This is so long. So it means if you are exposed to elemental mercury over time, it will be like overloaded in our body. And inorganic mercury is same. Half-life is 20 to 66 days. But it has a very low lipophilicity. It means it's not lipid absorption. It doesn't have a lipid absorption, so it cannot cross the blood-brain barrier. So, and also it has a poor gastrointestinal absorption. So mostly inorganic mercury enters to our body through skin. And the last one is organic mercury. It is also high lipid absorption and lipid transfer. So it can easily cross the blood-brain barrier, placenta, also breast milk, and then rapid absorption by also lungs and kidney. And one more point, it has a lot of dangerous effect in our to our body because it's also easily absorbed by gastrointestinal tract. That's why when you eat fish, already digest the methyl mercury once you eat. So the mechanism is like that. About the excretion for elemental inorganic mercury is primarily via the urine and also feces. For organic mercury is mostly by the feces and hair too. So when you measure the hair mercury content of hair mercury, so now we know how mercury enters and how this is processed. And let's see how mercury affects human health. So as you see in the previous slides, so they are both two mercury types are very toxic to the nervous system. So the primary organs is nervous system, in yellow color. And next is the cardiovascular system and kidney, because excretion is high in the kidney. And liver sometimes, liver and cardiovascular heart, lungs, and the skin. So they can also occur both acute and chronic conditions with these organs. So it is the general exposure is from when you eat fish, or when you expose to the contaminated soils, it is with the fertilizers, which has a mercury compound, inorganic compounds in there, and cosmetic soaps, and even the mercury-containing products like batteries, fluorescent lamps, and from waste. So this is a general exposure. But we also need to think about occupational exposure. This is the like manufacturing products of who are working in the manufacturing products of fluorescent lamps, batteries, and the medical device. And of course, the main is the ASCM mining and other industries. So now I would like to talk about acute poisoning from we can get it from each kind of mercury. The first one is elemental mercury. It is acute poisoning. Acute poisoning happens when you inhale a high amount of mercury vapor. You can see in the picture, see that the child is standing beside her mom. Her mom is burning the migrant. So it is a lot of mercury vapor are dischargent emit into the environment, atmosphere. So the child inhale the mercury vapor. So constantly he or she has consumed a high amount of mercury vapor. So the symptoms within a few hours can happen. The symptoms are in the mouth, such as inflammation of the mouth, lips, and gum. And others in respiratory system is acute necrotizing bronchitis. As well, you can see the shortness of breath. And in the lungs as pneumonitis, you will suffer chest pain. And if it is so severe lungs collapse and it's very fatal, is deadly. And then skin and nose irritation. So this is acute poisoning. Next is very popular one is a chronic intoxication. So chronic intoxication happens when you are exposed to more than 5 to 10 years. And this sign and symptoms starts at the blood level of 100 milligram per milliliter of mercury. So, but before that, maybe the chronic symptoms cannot appear. And there are 3 symptoms. So we have to remember that. It's called a clinical triad. First, a tremor. Second is a neuropsychiatric disturbance. And third is gingival stomatitis, means mouth ulcer, inflammation of the gums, like that. The first one, I will start with tremor. So the kind of tremor seen in the chronic mercury intoxication is intention tremor. So intention tremor means that when you want to do something, move something, as you see in the picture, you want to hold a cup, but you have a very shaking hand and tremor, and then so the cup cannot hold and drop down. So, but the tremor cannot happen when you just sit. Resting tremor cannot happen. The resting tremor is a sign and symptoms of Parkinson's disease. So it's different from the Parkinson's disease, and also different from the tremors of thyrotoxicosis. Those thyrotoxicosis has other like protruding eyes, and then first pause and increase thyroid gland wider. So then tremor will go to the face, and then finally progress to the whole body. It's like look like a dancing when you see. It's called the choreiform movements. So now another one is a neuropsychiatric disturbance. This is very dangerous. Some people can even commit suicide. So they have a lot of depressive, like manic depressive psychosis called the mad-hatter syndrome. And that also can have the memory loss, fatigue, anorexia, and then last one is mouth issues. So as mercury attack the central nervous system, the main is the central nervous system symptoms, tremors, and the neuropsychiatric disturbances. So, the erythema. Also, people can also suffer erythema. It means shyness. Pathological shyness is too much shine. It's not like a natural shine pathology, and irritability and hallucinations can see the people who are not really present. It's like a ghost. And so, and now another one is inorganic mercury. Inorganic mercury, it's not very different for acute and chronic intoxications. So some has a gastrointestinal ulceration and hemorrhage, so peptic ulcer, stomach. So we will think that this is just a ulcer from the stress, but no, it's because from the exposure to the inorganic mercury, or other is we call it acrodynia, pink disease in 1930. It was also a very famous disease back then. So at that time, people didn't know about the mercury poisoning, so they were just called a pink disease. And because of the teething powders. And finally, the acute tubular necrosis, kidney disease. So organic mercury. Now, chronic intoxication, you already heard that this is Myanmar disease, similar to the Myanmar disease kind of. Fetters, so it happens when we eat the contaminated fish or shellfish regularly. You have to eat regularly, not like not irregularly, over an extended period, like you were eating this contaminated fish every day and for a long time. And the factors that can affect age. Age means when you are very young, your brain is still developing, like in the child. So they are very easy to be affected by the mercury, methyl mercury. And genetics also plays a role. Nutritional deficiencies, such as when you have not enough iron or folic level, it can make worse of this chronic intoxication, alcohol consumption. The symptoms are similar to the chronic intoxication caused by elemental mercury, such as paresthesia, ataxia. Ataxia means you cannot walk steadily. You were walking like a drunken person, can be fall down, and hearing impairment. Dysarthria means cannot talk, defect in the speaking function, and progressive constriction of the visual field. This you can see in the clinical test when you see with the finger test to the eye. You will see the progressive constriction. So this figure shows what happens when methyl mercury affects the brain. So it will thoroughly work at the dopamine receptors, causing the glutamate dysfunction and calcium and MM receptors. So it's called the hyperexcitability, means a lot of reflex happens and ataxia happens. And it doesn't stop there. It can also affect the fetus, unborn fetus. So when pregnant mother eat contaminated fish regularly, and the most organ that has the most lipids, they will go breast. Breast a lot of lipid tissues. So mercury can also be found in the breast milk, sadly. And the brains, methyl mercury is able to reach the blood-brain barrier, and then placenta umbilical cord. It can cross the placenta, so it will affect the baby's brain, which has very high concentration of lipids. So that's why fetus and young children have increased risk. So, but another thing, very important impact is it is not reversible. It is permanent if once impact to the fetus. So we have to consider and we have to give a lot of care when we are pregnant, when you eat fish. It happens during the second and third trimester. It means after 3 months of pregnancy is the second trimester. And when this is the developing time of the fetus. So we have to care about what you eat and what you apply, such as of course, mercury containing whitening grains also can have fat, and children born can have other lot of symptoms. I will show in the next slide. So the picture shows that this is a neuron directly affect the neuron of the brain of the fetus. So and this is a disease that we can see in the children if you have prenatal exposure of mercury during pregnancy. So the arrow shows the dosage of mercury. So the light, if you dispose of mercury in very low amount, and the children born can have in their late life increased cholesterol and blood pressure. This is because of effect of mercury on the cardiovascular system. Low cardiac rate variability. Another to the brain central nervous system is memory and attention problems. Children cannot concentrate, cannot give the attention. So it's like similar to the autism. And the visual spatial disability means disable of the vision and deficit in the fine motor function, cannot do the very fine task movement. And language disorder, speech disorder, and delayed developmental milestones. So compared to the other children who have no prenatal mercury exposure, these children, their development has been very delayed. So it's like they cannot walk in the around okay, 1 year old, 1 year a little bit, the child should walk, but the child has delayed walking during the time, and vision and hearing loss. And other seizures means like epilepsy types of episodes, and ataxia and cerebral palsy. Cerebral palsy is the same symptoms we can see in the Myanmar disease. It's like they cannot walk forever. They are bound to the wheelchair. And then intellectual disability, IQ lost. And if it is too high, intrauterine early neonatal death. So children in fetus can die without born. So this issue is very serious. And so now we know how dangerous mercury chronic mercury intoxication. So how can we diagnose this? So let's see. So the very important one is that we have to get the history and clinical examinations. History, because there is no standard guideline to diagnose chronic mercury intoxications. So history, we have to ask occupational history. So have you ever walked in a mining area? Have you ever exposed to mercury like that? And lifestyle. Lifestyle means do you also apply like creams which have a whitening effect like that? And dietary exposures means ask about the fish consumption. What kind of fish and how many times do they eat? Another next one is the symptoms. Symptoms, if you see the symptoms, they have similar to other diseases, but the very peculiar symptoms, metallic taste and excessive salivation. So these are the very peculiar symptoms. And then behavior and personality changes, and poor concentrations cannot have, and depression with no reason, and insomnia, sleeping problems, and the hallucinations. So next, clinical examination. So let's start from the mouth. We see gray to bluish discoloration of the oral cavity. You will see and tremor in the fingers when you ask patient to touch finger to nose test. We usually do in the testing. So we will see the tremor. And Roomba test means you are cerebellar sign testing. And the gestidal cokinesis is a rapid hand movement. Ask the patient to do rapid hand, and you will see that whether they can do or not. And then he do Shing test. This is the kind of neurological examinations and neuropsychological tests. So at laboratory tests, so biomarkers, there are 3 biomarkers right now. For elemental inorganic, because they are excreted mainly from the urine. So urine is the best indicator for both elemental and inorganic mercury. So if that normal should be less than 5 microgram per liter. Yes, and for organic mercury is that mercury concentration should be tested. It should be less than 5 microgram per liter. And the hair analysis is usually done in a lot of surveys in the present time, modern time, because it's easy to do it. Let's consider when you go to survey, it's very uncomfortable to do the blood test and urine test, and when there is no facility, so researchers used to do the hair analysis, but hair analysis alone is not enough. So mostly it's symptoms and clinical findings are more important. And this is the journals published for the parameters of medical sum score of the chronic inorganic mercury intoxication. So I like to introduce this one. These are the parameters. So there we will investigate the 13 scores. So if the patients or the participant have 10 out of 13, so it is let's say chronic signs of the chronic inorganic chronic mercury intoxication. This is usually done in ASCM walk-in sites for ASCM minors and communities. So ask about the metallic taste, excessive salivation, tremor at walk, sleeping problems, nights, health problems worsen since mercury exposed, and then clinical data as I said in the previous slide, will create a bluish discoloration or ataxia, finger to nose tremor, and the rapid movement of hands dysfunction, and the heel to chin ataxia, proteinuria. And the neuropsychological test means the Meshbao test, pencil tapping test. So mostly I do in the survey, I do the Meshbao test. We ask the participants to pick at the match and put it in the box, and let's see if they can do. So these are the scrolls. And then this is the level of the mercury in the urine and blood and hair. So the exposure, they have the exposure level. So the first one, if mercury here is less than 1 and less than equal to 1, okay, so it's say the low level. And blood also should be less than 5. And urine divided by the creatinine level should be less than 5. But if urine alone should be less than 5 microgram per liter. So this is a very low level. And alarm level becomes, as you see in the table, between 1 to 5 mercury in hair. So I will just only talk about the hair because it's mostly used in the surveys. So 1 to 5. Also, if the hair content of mercury content of health, so like that. So this is the medical score, 0 to 2, and 3 to 4, and 5 to 10. So if the patients have 5 to 10 scores in the algorithm score and have at least more than exposure limit, then it is we can say that it is the person is suffering from chronic mercury intoxications. So if the medical symptoms have 0 to 2, then doesn't have mercury intoxication. So as you can see here, so the most important thing is we have to do the clinical diagnosis. Now, next, I'd like to introduce some case study in the literature. So there are 3 case studies. So the first one is about the one ASCM minor. But first, the doctor didn't know he has been working in the mercury mines, but he has 3 months history of low-grade fever, severe insomnia, behavior changes, visual hallucinations, and hearing difficulty, weight loss too. And then he suffered from the ataxia, he cannot walk. And then burning sensations, muscular fasciculations, and then incomplete bladder findings. But the other investigation says all came with a negative. But when they asked about the occupational history, he's been working for 6 months previously in the Liberia at ASTM. So mostly he was handling the mercury gold burning. So in examination, vital signs are normal. Only the neurological signs are present. And so blood concentration, mercury concentration is higher, 8.83 microgram per liter. So they can diagnosis is chronic mercury intoxication, and the patient is given the steroid therapy. So he's been recovered later, but if we don't know if this is a chronic mercury intoxication, it is very difficult to do the treatment. So the presentation of chronic mercury intoxications is very vague. It's not different from other systemic illness. And next case study 2 is about the mercury in urine of the children. So in the graph, the first one is a control group, the children who doesn't walk, doesn't live in the ASCM minors. The second higher, a little bit higher is they are living in the ASCM area but not walking. And the highest one is living, also walking. So in examination, they have increased urine mercury level. And then the examiner asked the children to do this diadokinesia is like rapidly asked to clap, not clap your hand, like do this, like this. And if you can do like quickly and correctly, then you don't have the cerebellar damage. But so interestingly in the graph, so the children who are walking in the ASTM minings and also living there have a very like defect in this examinations. So cerebellar is quite a good indicator or diagnostic indicator for diagnosing the chronic mercury intoxication. And another one is tremor. This is a significant survey. There is a girl, is 9 years old. So it have an accidental intake of the seed preservatives containing mercury. He's not in the mining places. He's been just exposed to the preservatives, and he has episodes of tremor. So when the examiner asked her to write her handwriting, as you see picture, so cannot write after 5 sentences. It's very disrupt handwriting. So so the last one is prevention. How we can prevent? So this is as simple as we don't use mercury. We stay far away from the mercury. So the first one is the replacements. We have to replace mercury-containing products to mercury-free products. For example, light, fluorescent lights. So there are free mercury-free LED lights. So we can use for the replacement. And another one is dental membrane, so can change to the white filling or the ceramic filling. And now the medical device can change to this modern current innovative medical device. And then this is the mercury products, containing products. Of course, when you see that this product doesn't have the FDA approval and has illegal cosmetic, you have to stop using this, avoid using illegal cosmetics and whitening creams. And that limit the consumption of mercury containing fish. This is like a controversial topics. You know, like fish, like a tuna has a lot of good compounds, good elements for the children, you know, like DHA, EPA, but also it is harmful because it contains mercury. So then, but we cannot say that you have to stop eating this, but you have to reduce the amount. Of course, the salt fish should avoid consumption of fish during the pregnant and nursing mothers and young children, but they are very susceptible to be affected by the methylmercury. And the fish with lower levels of mercury, you can reduce the consumption, such as no more than 12 ounces, but in gram 340 grams per week. It means like in pregnant women, it is advised to eat a maximum just 3 days a week of fish. The other, you cannot eat fish every day. In like tissue, the methylmercury is bound to the tissue protein, not in the fatty tissue. So it is not like a partly, it's the whole fish and the whole tissue. Therefore, trimming or skinning cannot be affected, cannot reduce the mercury content. And cooking does not reduce the amount of mercury. And lastly is prevention at the mining site. The first one is avoid exposure to mercury. And banning in the designated area, you cannot ban in the village, and where you have to ban an outside and designated closed system away from the children and women, and safely store mercury. And of course, wear the mask. Mask is also like not a normal mask, is for gas protection mask, and safe waste management, and also avoid the cyanidation of the mercury contaminated materials. This is a protection. You can protect reducing exposure to mercury, and that reduce amount of mercury use. It means you have to use alternative methods of mercury, not mercury method. No hole or amalgamation, and quality control, milling, and you can use the retards. So lastly, remove mercury from the gold process, and the gold refining process means mercury-free refining process. So it is for the risk reductions. As you heard in the Professor Sakakibara's presentation, it is very difficult to handle the ASEAN problems is complicated. So we have to work together with the stakeholders and the researchers and community work together, find the solutions. And thank you very much for your attention.
Thank you very much, Dr. Thiri. Very nice presentation and very detailed lecture. I think we still have about 30 minutes for the discussion. So there are about 200 participants has been joined with us, and many questions has been noted by the operator. So maybe the question can be shared to the screen, so the speaker can also notice the question. This the operator maybe can share. Okay. Okay. Maybe a large one. Zoom it, please. Okay. The first question is from Dr. Slamet. This is for Sakakibara Sensei. How to simple identification to know that the environment, like water or soil, has been polluted by mercury. So maybe you have any suggestion on that?
Okay. So this is a very important portion because first we have to evaluate so simply, and then it's a very easy example in Indonesia. So just mercury contamination source is mainly gold mining. And then if there are any gold mining site near so just your living area, or so just your focusing area, this is maybe you can have a doubt. This is most important for Indonesian. But other so just area, it's example factory. Sometimes so just people believe so just a factory use mercury, but I didn't found in Indonesia. Like Chisso Corporation in Japan, but maybe of course need a scientific so data what they make, what they so just what they make the product using mercury or not. Maybe, and then so now I can say, if you want to understand the mercury pollution, maybe please check the gold mining activity. Yeah, in Indonesia.
Okay, thank you, Sensei. Yeah. The second question is from Angelina Febriani. What kind of collaboration of research and what kind of stakeholder to, I mean, involving the all stakeholder to solve which problem, especially in Japan? So based on your experience, of course.
I suppose so. Just the Asian country have a difficulty because so Indonesian and then Japanese also have a kind of hierarchy. Hierarchy means the in the society there is a layering. Example, so just a common citizen, and then maybe I think higher rich people, and or maybe politician, and then commonly. Example, so in the local community, sometimes collaborate with researchers. But commonly we get the problem is not so simple, and then need a political power also. Political, so just a decision. And then I think not easy. I think now, so I cannot show the good example in Japan. Maybe other Asian countries also have the same problem, but the Western country, it's they commonly think about the problem logically, and then also maybe human rights also very flat. and then they can collaborate with, sometimes collaborate with politicians, then also common citizen can collaborate each other. I think this is a social, maybe governance or social structures problem. And then in Japan, also not easy to solve the problem. Of course, they collaborate, but didn't solve. This is my answer.
Yeah, thank you, Sensei.
Yeah.
I think this is the opportunity also for us to doing research on that case.
Yes.
Yeah. Okay, the question is from Dr. Tukiono. He's also a toxicologist. The question is put to Sensei and also Dr. Thiri. The first question is lead. Is heavy metal also used in human life, such as in mixture of fuel? How is the impact of the lead pollution on the environment and human health? And the second question is, in Lampung, there are still many people who use mercury in illegal gold mining. So this is small-scale gold mining. So it is the potential to cause the river ecosystem pollution. The question is, how long will the impact of the mercury pollution on human health, such as, I mean, this is based on the experience also, based on the experience in Minamata cases. So the question for the Dr. Thiri is, there are 3 forms of mercury, which one is the more stable in the environment, and which one is the most dangerous to human health? Please.
Okay. First question, Thiri-san, you can answer the lead pollution effect.
The lead, yes.
Like lead is a heavy metal used in human life, such as a mixture. Yeah.
Thank you for the questions. So lead, yes, lead cannot be, I mean, we cannot say apart from that. When we talk about the heavy metals, so the lead and mercury can be together, can with the mercury explosion, lead together in the mine site. So the lead is seriously impact to the also brain. They can cross the blood-brain barrier, and then others are the lungs and the kidneys. So it is also harmful to the human health. Thank you.
Okay. And the second question is maybe how long? So just the impact of mercury pollution on human health. This is of course, this is also a very difficult problem. So first, maybe we should understand. So metal mercury, liquid mercury is different from methyl mercury. Of course, methyl mercury easily enter the organ, so in the animal and the human being. And then Minamata, this is also, of course, very famous, but maybe people ate polluted fish, but extremely polluted. And then problem is if the concentration, so just fish, mercury concentrated fish is lower than so just standard values, whether we have an effect or not. But there are no data, I suppose, the low concentration. But commonly in the mining site, the miner also collects the mercury as possible as they can. Okay, and then contaminated level is, I think, less than maybe few thousand ppm in the waste material, and also maybe evaporated mercury expand to the atmosphere. But of course, this is not so high. But if we live in this area environment long time, okay, not so serious effect. But if we stay, example, so in the polluted area, maybe more than 20 or 30 years, what happens so for us? This is that there are no data now. This is also very low concentration levels, low pollution levels effect. We didn't know exactly this one. Yeah, this is a very important portion, but we cannot so answer easily. But we have some example data in the Gorontalo province case. The miner so ate the 20 years the fish in the polluted rivers, and finally he couldn't so walk by himself. Yeah, this means that so maybe around maybe more than 10 years if they directly eat the fish in the polluted rivers. Within so 10 years they have an effect, and then after 20 years later, the person couldn't walk by himself. This means that maybe, but of course after river, the polluted water enter the ocean. Okay, this is also maybe have an effect, but we don't know exactly now. And then first, maybe how to prevent this effect. Maybe we have to so just to prevent to eat the fish in the polluted rivers directly. And then also maybe later maybe ask a question. So just how much consumes we can. This is also maybe not so clear. Japanese government so just suggest us. Of course, they so just dialogue with researchers, and then commonly when so just females so just are pregnant, the medical doctor say please stop to eat salmon, tuna, and then bonito, like that. So just there are the recommendation, but we are not clear. Just only protect by some of so just based on by the some of suggestion by scientists, government, but we are not so clear. Yeah, this is also maybe in the polluted rivers. We never, of course, eat polluted fish. Yeah. This one, so just yeah, consume. This is also Dr. Thiri explained how to so just reduce the fish consumption. But of course, for Indonesian, fish is a very important food. And then, so what we can do? Example, so we have to so analyze the many species of fish, and then fish is lower than other, and then we can find so just lower concentration of mercury on some fishes, and then we can recommend to eat that one. But if it will be higher than other, maybe in the polluted area, so we have to stop to so eat that one. But now we have no data. In the Minamata area, we have a data already. And then government people can so see the fish is higher than other. But of course, so including organ, and then more safety eating method, take off head and then take off organ, and then to eat that one. This is also protection, so just a method. But there are no so indicators to consumption. Yeah, just maybe stop to eat after pregnant. Yeah. The female so just can stop. Yeah, it's this is my answers.
Okay, thank you, arigato sensei. Maybe we can also extract the fish to be more safe. So the food processing is more important then.
Yeah.
Yeah. Okay, Dr. Thiri,
Yes.
please.
Oh, so sorry, I missed the question 7, right?
Oh, okay. The operator, please scroll up the screen. From Pak Tukiono to Dr. Thiri. Yes.
Yes.
Thiri,
Okay,
yeah.
thank you. This is good questions. But elemental mercury, which can be converted to the inorganic compounds in the air, so it's not elemental mercury is not stable. So elemental also can be transformed to the methyl mercury. It's not the stable compound. So if you have to say, so the methyl mercury is the most stable in the environment. It cannot be changed back to the elemental mercury. I mean stable, and also which methyl mercury is the most dangerous to the human health.
Okay. Thank you, Dr. Thiri. Come to the next question, please. Operator, please scroll up a bit. Yes. From Atika, sorry, the number 4, question number 4. Scrolling down. Okay, yes. As we know that the Japanese consume a lot of fish, like Indonesian, especially in Lampung province. So what kind of protection to save us from the pollution to consume fish? I think, yeah, this is the similar question, Sensei.
Yes, yeah. Maybe, maybe of course, so Japanese, common Japanese, so don't worry about mercury, taking mercury from fish. They like salmon, they like tuna. But especially, so medical doctor so suggest pregnant the female, please stop to eat the salmon, tuna, bonito. After 3 months, so the fetus. That's all. So just there are no limitations. So just from the government. But of course, we can get the information so easily. And also, even in Minamata area, so nobody, so just, I think, have a limitation to eat a fish. But of course, increase methyl mercury, some of the fish. And also, maybe please understand like this. We have a metabolism, so just a process. And then we can take off the mercury from outside to the outside, okay? Example, hair also. We don't need a mercury, and then we so just take off the mercury from the body. And then we can detect the mercury from the hair. This is maybe based on the metabolism. And then so if you can find a lot of mercury from your hair, your body is very normal. Commonly, so people worry about the higher concentration, but this is the maybe final, so just process in the body. And then if we cannot take off the mercury from the body and the organ, maybe this is also a problem. Yeah. Please understand like this.
Okay, thank you, Sensei.
Yeah, and then now don't need to worry about fish consumption now.
Don't worry too much.
Yeah, and then just pregnant female, so just please, so just carefully eat. Maybe make government can make some rules, some so just a lifestyle. Yeah.
Thank you, Sensei. The next question is from Mr. Sugeng. This is the question put from to Sensei and also Dr. Thiri. This is a very nice question because what is the your advice to recommendation, particularly how to convince the government, especially in a local government, to develop the policy to protect the public health. So,
it's very important.
Yeah.
Maybe I never collaborate with the Japanese government, but I think first, if you want to collaborate with the government, so please find informal the collaboration, because government officer also cannot say easily officially, okay, and then informally, so just they can talk, I suppose, and then so just please make the network with them, and then start the community of practice together with them, and then so just can discuss about the policy. But the next step, we need a multi-stakeholder process, the official process. This is also maybe, I think, a gap between the informal to the formal. If you want to do, I want to support you, and then shall we collaborate? Yeah.
Yeah, thank you, Sensei. This I think as the keyword is collaborative and innovative approach. Yeah, this is also the opportunity to doing some research here. Yeah. Question for Dr. Thiri is how to minimize the impact of the high polluted mercury at the sea.
Thank you for the questions, but I have never know about some kind of plantation of certain trees or in the ocean. But to minimize the mercury pollution in the sea, is the first way is reduce the alternative products other than the mercury in the industry, and don't use mercury in the ESG mining. And well, when you have to discharge the waste from the ESG mining, please do the proper treatment to remove the mercury before discharging to the sea. This is from my side. Professor Sakakura, do you have any idea about the plantations, please?
This is
maybe absorbent, maybe Sensei. Yeah.
But the huge, the ocean's water, so just the huge volume, and then not realistic. Before enter the ocean water, so we have to reduce the mercury contamination. Yeah, examples before enter the river water, before enter just the ocean, we have to take off the mercury. But this technology also, I think some of researchers study on that one, but not so just social. We didn't get social implementation, and then so still have problems. But we can reduce the taking mercury by ourselves. Example, when we eat the fish, we have to take off the organ and or take off the head. Maybe most contamination of mercury in the fish, mainly brain, and then maybe organ inside. Yeah, we can take off, and then so just we can only eat the muscle.
Yeah. Thank you, Dr. Thiri and Sensei. This is, I think, is very nice suggestion to consume the fish actually. But however, I think there is still potential to research on absorbent, what you call it, the kind of vegetation or something. And the next question is from Pak Rian Saputra. How the best practice to handling hazard environment risks that exceed threshold limit value, such as coal, dust, which has a health risk of heavy metals such as lead. Okay, this is the information. We have also plenty of coal mining, and also what you call it, the energy generator based on the coal mining. So please, Sensei.
Maybe so Japanese technology already, we can reduce the mercury contamination from the coal dust and also smoke. But Japanese government didn't just share just Indonesia, I think. Because so they worry about China will take that one. Copy.
This is a confidential.
Yes, it's very political, so just a problem. But we have to beyond this idea, because so I already told you, so just because if in Russian, so atmosphere will be polluted by mercury, I mean, this effect also maybe fall down to Japanese. Yes, yeah, and then we should so just beyond this idea, yeah. And also there already we have a technology, but how to share that one?
Okay, again, this is very complex problem. So
yeah. That's a company.
Yeah. Thank you, Sensei. So maybe we hope that we can further implement the technology in Indonesia. So the question from Pak Jufri, this is for Dr. Thiri. Based on your project, what is different of characteristic ESGM in Indonesia and other countries? So hopefully you have already learned about the ESGM in Indonesia. I mean in Sulawesi. Please, Doctor.
Yeah, so according to my experience, so in Myanmar, ESGMs are done in the very near to the housings in the village. So, and also the nature odds is also different from the Indonesia's, and so it means that even if we don't use a mercury in Myanmar, it can be collected. The gold can be collected. That means that more easier to collect the gold. But the people are more used to using the mercury because it's less time and less, so they are using. But compared to the Indonesian side, Myanmar has more potential of the retrieving gold, and also like in the river. So even now, so the people, they can get the gold by doing the panning in the water streamings in the river, and it's kind of like a place of gold. So according to my experience, these are the different one. About the clinical symptoms, Indonesia has more like neurological symptoms. It's more mercury related chronic intoxications. But when I study in Myanmar, I didn't see such kind of very severe neurological symptoms, but instead we have a lot of lungs disease from inhaling the dust and during the ASCM walking, the excavation of the ores, gold minings when you go to the underground. And so a lot of miners, after they work for after like 10 years, so their health is very bad and they cannot walk anymore. It's like lifespan is until like only walking, occupational lifespan is only about 10 years for men for doing ASCM walkings. So it's compared to the Indonesia side, plans is more severe and less severe on the neurologic disease. So it means in Myanmar land, mercury effect is lesser than the Indonesia. So Indonesia use more mercury in the minings. Thank you.
Thank you, Dr. Thiri. I think it's that one is our last question. Apologize for the all participants that we cannot answer all of the question because the time is up. So maybe we can send the question to the Sakara, to the Sensei and also Dr. Thiri, and maybe we can receive the answer later. Okay, I think I would like to highlight that there are a lot of potential collaborative research, I think, in the future. So hopefully Sakakibara Sensei and also Dr. Thiri have opportunity time to visit Lampung maybe, and then doing some collaborative research with the University of Lampung.
Yeah.
Thank you again, Dr. Sensei and Dr. Thiri. Yeah. Have a nice day. And yeah, apologize for all the inconvenience during the
there was
discussion.
no inconvenience. It was so smooth. Yeah. Thank you.
Thank you very much, all
Thank you very much.
participants.
Thank you very much for James and MC and Dr. Endro. Thank you very much.
Ya,
Sampai
thank you.
jumpa.
Sampai jumpa arigatou gozaimasu.
Ya.
Ya, saya kembalikan ke MC. Kartika, please. Screen is yours.
Thank you so much, Professor Masayuki Sakakibara, Dr. Thiri, and also Dr. Endro. Ladies and gentlemen, we are now come to the end of this event, International Guest Lectures on Environmental Health, Medical Geology, Heavy Metal Pollution, especially mercury in humans. Before we close this session, the host will take a screenshot for this event. So please turn on your video for a moment and don't forget to give us your best smile.
Oke, silakan buka kamera yang memungkinkan untuk kita ambil fotonya. Satu, dua, tiga. Senyumnya ditahan, ini banyak slide-nya. Oke, thank you.
Thank you.
Thank you.
Selesai. Terima kasih semuanya. Thank you.
Thank you,
Thank you, Mas.
Sensei.
Thank you.
Sampai jumpa.
Thank you. Ya.
Thank you,
See you again. Yeah.
Pak Endro, Pak Slamet, Bu Dekan, Pak Endra.
Terima kasih banyak Ibu Susi dan tim.
Sama-sama. Tadi ada Prof. Sutiarso, ada Bu
Ini ada Dr. Thiri.
ada Pak Samsul. Terima kasih semuanya.
Izin pamit Bapak Ibu. Terima kasih banyak.
Sama. Silakan IP kan? Silakan dari host kan?